Hello, everyone. My name is Franz Serpa, and I'm a PGY1 internal medicine resident at the University of Texas Southwestern Medical Center in the United States. It is my honor to be here with you at the Heart Rhythm Congress 2024 in the UK, and it is also my huge honor to present on behalf of the entire team our project titled Synchronous Pacing with Leadless Pacemakers, a case series analysis using the synchromax system. I have nothing to declare with this presentation. As you know, leadless pacemakers have become an established therapy for patients with bradyarrhythmia since their clinical introduction in 2013. You can see here on the table the 2021 ESC guidelines on cardiac pacing and cardiac resynchronization therapy, showing us the evidence available to use leadless pacemakers in cases when there is no good upper extremity venous access or in cases when there is a high risk of device pocket infection, and also whenever there is a shared decision-making with our patients. From that, we also know that the right ventricular septum has gained attention as an alternative pacing site to the traditional right ventricular apex, and the shift is supported by studies suggesting that septal pacing may improve ventricular synchrony and is associated with a lower risk of complications such as cardiac perforation. However, the optimal septal implantation site and the best non-invasive method for assessing ventricular synchrony remains unclear. Therefore, we conducted a case series analysis of 20 patients requiring leadless pacemakers at our institution in Ecuador, and we used the synchromax system to assess the degree of interventricular synchrony. And this synchromax system is basically a portable ECG monitoring device that amplifies and averages the activation times of leads 2 and VIS6 from a 12-lead ECG to generate an index that reflects the electrical synchrony during cardiac activation. As you can see here in the image, we have the synchromax device, and we also have a table showing what is considered a synchronous activation based on the synchromax index that goes from 0 to 0.4, and also what is considered a dysynchronous activation based on the synchromax index going from 0.71 to 1. Here you can see a figure showing all the implantation sites in the case series analysis that we perform. As you can see, we divided the interventricular septal in 9 quadrants, going from upper, middle, and lower portions, going from basal, medial, and apical as well. And here we have our results where we use the NOVA to calculate and analyze the mean differences pre and post implantation. And notably, you can see that there are septal positions, including the middle basal and the upper medial, that show the graded synchromax index variation, suggesting improved synchronous ventricular activation. And notably, all these results were statistically significant. Also here you can see on the image on the left that we have similar patterns in ventricular activation based on the QRS variation in the same positions as shown before. And also on the image on the right, you can see the synchromax index variation according to the implantation site as well, similarly showing similar patterns of change. Therefore, we can conclude that in this initial case series from Ecuador, we found that the middle basal and upper medial septal positions offered the best ventricular electrical synchrony activation as measured by the synchronous system. The synchromax system is a non-invasive assessment of ventricular synchrony activation, which is feasible and that holds the potential for optimizing physiological pacing. Finally, future efforts should focus on larger cohorts, prospective studies, and follow-up electromagnetical analysis to clarify the clinical impact of synchronous leadless pacemaker implantation, which is an area of current interest in our group. Finally, I just want to acknowledge and thank the entire author block, the entire team here with the principal investigator, Dr. Diego Egas, and the entire co-author block, Dr. Francisco Rodriguez, Javier Rodriguez, Diego Serrano, Cristian Fierro, Galo Galloa, Carlos Noroña, Claudio Zuluaga, and Dr. Esteban Ortiz from Ecuador. If there are any questions, please feel free to reach out and we are happy to respond and clarify any of our findings. Thank you so much for your attention. And again, it has been a pleasure to be part of this amazing meeting. Thank you so much.